Good afternoon. Welcome, everyone. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at Hamilton Health Sciences. Really pleased to have everyone join us for this virtual press conference today using the Zoom format. We look a bit like the Brady Bunch here, but we're trying to do everything we can to limit social exposure to one another and to those that are working in healthcare. So here we are. Thank you for making time for this. I'll give some housekeeping rules for how we're going to proceed. We have a panel of speakers who I'll introduce off the top, each in sequence, and then we have some time for questions. Each of the journalists that's joined us today has the opportunity to ask one question and one follow-up. You'll be called upon, I'm presuming in the order that you arrive in the chat forum, so we'll have a moderator who will do that. If you could, when you ask your question, please state your name and your news outlet that you're representing today. And also, if you haven't had the opportunity yet to adjust your screen so that your name is visible, you can do that by simply hovering over in the participant box, hover over the name, click more, and then click rename, and it'll give you that opportunity there. So thank you very much. So we'll get right into it. First, I'd like to call upon Dr. Elizabeth Richardson, the Medical Officer of Health for the City of Hamilton, to tell us a little bit about where we're at today. And you just have to unmute.
Got to unmute ourselves, don't we? Hi there, Aaron. Thanks for that. Just going to start off with a little bit of a case update and then transition over to our partners here around the table. So as of today, as of noon today, we have 183 confirmed cases of COVID-19 in Hamilton. We have 5 deaths. That's no new ones since reported yesterday. So a total of 3 that people had passed away at Heritage Green, 1 from Cardinal Retirement Residence, and then 1 community case who had passed away in hospital. So as I said, that's unchanged from yesterday's briefing. At this point, there's been 42 cases of COVID-19 that seem to have come from community spread, in addition to other travel-related cases. And then there are 77 cases that are close contacts with the case and have no travel history. So again, this is underscoring for us that really the community spread and contact with others is the most common way that we're seeing our cases come forward at this point in time. It's also important to remember that of those 183 cases, we have seen 73 of those cases that have resolved. We do work with those cases every day to make sure they have the things that they need and to help them with self-isolation and answering any questions. And at this point, we know that 73 of those have resolved. So again, for most people, COVID-19 is sort of a bad cold, but unfortunately, there are people in our community for whom it is much worse, for those who are over 65, for those who have chronic medical conditions or immunosuppression, and then they can go on to develop things like pneumonia and need intensive care in hospital as well as in the ICU. You can, of course, find more details about our cases on our website. I'll just go over those outbreaks for you. There are not any changes in numbers, but at Heritage Green, we have 10 confirmed resident cases, which does include those 3 deaths from Heritage Green, as well as 3 confirmed staff cases. At Cardinal Retirement Residence, we have 14 confirmed residents and 5 confirmed staff. That does again include the 1 person who did pass away, who was from Cardinal Retirement Residence. We have the outbreak at Wentworth Lodge, which still has just the 1 staff member confirmed. And again, we do declare an outbreak if there's any staff member or a resident from any long-term care home or retirement home. And so that's the case here with Wentworth Lodge with just 1 staff member. At St. Joseph's Healthcare here in Hamilton in the special care nursery, we do have 3 healthcare providers who tested positive in that unit. And so we're continuing to watch that closely. So we don't have a crystal ball at all to tell us what might happen in the next several weeks. You know, we've been talking about a lot about modeling since the end of last week that the province announced, and we've been looking at that here with our hospital partners and our subject matter experts that come from our academics and within public health as well. But one of the things that we are tracking is the doubling time of cases. And so generally we know that if things are just left unchecked, that the doubling time in terms of how long it takes for the cases to double in number, that's about 2 to 3 days in countries where they haven't had any interventions. But where we have had them, that number gets higher. And here in Hamilton right now, our doubling time is sitting at about 5 days. And so that's evidence that what we are doing, the hard work that everybody is doing in staying home, in going out as little as possible, and our essential workers only really being the ones that go out for anything except for groceries or for pharmacy visits or that sort of thing. So it is showing that we're having some impact. And again, it doesn't mean that it's time to let up. It's absolutely time to double down on these measures, as you're hearing from our partners at the provincial level and elsewhere, talking about the importance of continuing to sustain this as we go forward. So having said that there is some good news and that what we're all doing is having an impact, we are absolutely expecting to continue to see cases. And we, of course, are preparing for the worst in terms of what might happen over the coming weeks. And so we've been working together with our hospital and community partners to prepare our collective readiness for those coming weeks and months. And I'm going to turn it over to the hospitals who will provide more details on these plans.
Thanks very much, Dr. Richardson. So yes, over to the hospital panelists that are here to give us an update on some of the capacity planning that was mentioned. First, I'll go to Melissa Farrell, the president of St. Joseph's Healthcare Hamilton. Melissa, over to you.
Hi there, Melissa here. Working together, we really have been working quite a lot together across the whole city to take care of the community here. Very excited to talk to you about the work that has been underway over the last few weeks. There's really intensive planning that we've been doing, and as you can appreciate, this work is rapidly evolving and changing given the environment. So our goal collectively is to continue to build and operate safe space for our patients, our healthcare workers in our community. That's obviously very important. And to do this, we've been following some key principles as a collective. So one is making sure that we're really staying true to our missions as healthcare providers in caring for and protecting our patients and our staff. Making sure that we're really thinking about the approach that we're taking from a regional perspective and working through our local partnerships and working together. Making sure that we're paying attention to the guidance that's coming from the provincial government and from Ontario Health, using excellent modeling. And there's, I can appreciate that there's many different forms of that modeling that has taken place, but it has been very useful for us to determine what to create. So using the current data and information that we have available to project out what kind of scenarios we might be dealing with, being overly prepared and ready to respond as the environment changes. Really making sure that we look at expanding capacity incrementally based on key occupancy thresholds that we measure and that we know are important, adopting ethical frameworks into our decision making, and really trying to do our best, the best that we can to be prepared for the worst while continuing to hope for the best in these circumstances.
Thanks very much. Next, over to Rob MacIsaac, President and CEO of Hamilton Health Sciences. Rob, over to you. You need to unmute. Oh, Rob, you need to unmute.
Sorry about that. As Melissa was saying, Hamilton and Region hospitals have been engaged in an intense planning process over the last month and more in an effort to prepare for this pandemic. Our work has been based on provincial modeling, and we've also considered local demographics and projections about the spread of the pandemic to try to anticipate the hospital capacity that might be required. Consistent with provincial direction, we're taking a staged approach to ramping up bed capacity. And although some of the work for every stage is well underway, our planning work has focused on the early stages where building capacity within our existing hospitals is the principal strategy. Later phases further free up bed space and identify locations, equipment, and staffing models to occur in unconventional spaces, again within our hospitals. But eventually, we may have to turn to spaces outside of our walls. Ontario Health has been helping to direct this planning effort and has provided a minimum target for hospital bed capacity needed in Hamilton by the end of April. This amount is based on projections about the anticipated spread of COVID-19, which the government has already provided publicly. By the end of April, Hamilton Health Sciences and St. Joseph's need to create a minimum capacity equivalent to 261 acute care beds and 90 critical care beds. At present, our efforts have achieved this capacity and more. This has been accomplished by ramping down scheduled care such as outpatient services and non-emergency surgery and maximizing virtual visits wherever possible. At Hamilton Health Sciences, we have only 17% of our outpatient capacity remaining on site, More than a third of the total volume is now happening virtually. Other appointments have been deferred. Our surgical activity has been reduced by more than half. This comprises all non-emergency surgeries. Our diagnostic imaging volumes have been similarly reduced. This work, combined with reduced emergency department volumes and very diligent efforts to place alternative level of care patients in more appropriate community settings, has created a significant amount of early stage hospital capacity here in the city. However, we have to acknowledge that the pandemic we are facing is unpredictable. It's overwhelmed hospital systems elsewhere in the world. Accordingly, we continue to turn our minds to adding further capacity, and so our work continues. My colleagues will explain in more detail some of the current and anticipated next steps that we will take to open as many as 1,200 beds in Hamilton, should the situation require it. Aaron, back to you.
Thanks, Rob. Melissa, Farrell, I wonder if you could take a moment to walk us through some of the staged planning that was referenced earlier. What do those phases look like, and what can we expect?
Great, happy to do that. First, I'd just like to say that these really are unprecedented times for the hospitals. As you know, our hospitals in Hamilton usually operate at well over 100% occupancy. In the last month, in an effort to create capacity to care for COVID-19 patients, just to give you an example, at the Charlton campus of St. Joe's, we have opened up 40% of our beds, or freed up 40% of our beds. Similarly, we've scaled back on surgeries and procedures. These are very difficult choices, as you can appreciate, for us to be making, but and can be very hard for patients and their loved ones. But it is really important for us to make sure that we have the capacity that we're requiring here. We've had to find new ways of providing patient care. In the month of March, for example, we saw more than 5,000 patient visits virtually by video, telephone, and secure messaging, so very similar to HHS. For us, that's actually 1,000% increase in virtual care over the previous month, and virtual care is a very effective way of providing care directly to patients who need it, so very important part of the plan. The plan is, and the approach that we've been taking really is following the provincial model with a 5-pronged approach to accommodate an influx of COVID-19 patients. So I'm just going to walk you through the 5 elements. The first, as we've both said, as we've all been saying so far, we've scaled back our surgical procedures to open up those beds for COVID-19 patients. So that's step number 1. Step 2, we're discharging patients and relocating certain patient populations that can be placed into a community setting, and that really is connected to that ALC comment that Rob was making previously. Third, we're creating COVID-19 and non-COVID-19 designated spaces within our hospitals. Fourth, we're converting unconventional spaces for inpatient care inside the hospital. Those are things like lounges and cafeterias that are being explored for those. And then 5, we're planning on opening beds in unconventional community settings like hotels and convention centers. You've seen some of that in other communities too. So I'm going to turn it over to Winnie and Wes, who are going to provide more details.
Thanks very much, Melissa. So next, over to Winnie Doyle, the Executive Vice President of Clinical Operations and Chief Nursing Executive at St. Joseph's Healthcare Hamilton. Winnie, over to you. You just need to unmute.
I'm a slow learner. Thanks, Aaron. A couple of things I would just want to add some detail on to help you understand the sort of work that we're undertaking. It really, when we think about this work, it's creating bed space, it's creating clinical pathways, making sure we have the supplies and equipment, the models of care, and that our staff groups are ready to embrace this challenge. And work's been going on in all of those areas in our readiness. I'm going to speak a bit about what we've done in terms of beds. Melissa mentioned earlier, and Rob mentioned the total number of beds we are attempting to create. So as we speak today, we have a standby capacity of 200 empty beds here at St. Joe's. And we've done this, Melissa was going through the phases that we've gone through, reducing surgical care, reducing ambulatory visits here in the hospital, moving to virtual care. That's been a very important element. To give you some detail, in the surgical care, we're doing 76% less surgical care here at St. Joe's than we did before the pandemic was upon us, and we needed to respond. We've been moving patients that do require admission to hospital. Our length of stay is shorter and patients are going home sooner across many of our programs. We have patients in both of our hospitals with very specialised needs. We've been working with our community partners to transfer as many of those patients as we can to the community. So an example of that would be a partnership we have with Able Living, and we're moving complex patients with needs like tracheostomy to the community. These are moves that we do make in normal times, but we've had to do that work in a faster cycle to make this capacity available. Today at St. Joe's, we've undertaken moving 2 units, 2 of our mental health units, a total of 60 beds, from the Charlton Street to the West 5th site, and that is giving us incremental capacity of 60 beds here at this site as we prepare for the number of beds that we anticipate we may need. One of the principles in addressing this pandemic, and a common principle in infection control, is to separate patients who are infected or have the virus from patients who don't. So we are doing that across here at St. Joe's and at Hamilton Health Sciences, so that we have dedicated areas and dedicated staff, both in our critical care and in our wards and in our emergency rooms, to be able to achieve that separation to the greatest extent that we can, given the challenges that we face. Just in terms of the number of patients we have here at St. Joe's today with COVID-19, we do have 19 patients, and we have been able to have those patients separated and cared for with dedicated teams and in dedicated areas, both in our critical care and in our ward areas. In terms of our next steps, of course, we're looking at the capacity we have today and how we will grow that capacity as the demand grows. And in critical care, we have another 12 beds that will be free tomorrow in terms of critical care, and then another 57 we're bringing online shortly after that. So on the critical care front, I think we will be well prepared with the number of beds that we have available. Beyond the traditional space, when you think of hospitals and the sorts of rooms and units that we provide care, because of the nature of this crisis, and when we look at what's happened in other jurisdictions, we really want to be ready. So we're looking at all spaces in the hospital where we could provide patient care should that demand be upon us. So that could be congregate, where we look after patients in what used to be called the Nightingale ward, where our patients were all in an area together. We could do that in conference rooms, in potentially in other spaces we have, like day rooms and lounges. So that sort of preparation is in addition to the traditional bedded spaces. We're working across the city with Hamilton Health Sciences and many community partners, including public health, looking at what we call unconventional hospital space. Melissa mentioned it, and I think Rob might have mentioned it as well. Spaces like potentially hotel space, potentially large areas where we could manage patients if the surge is of that magnitude. I think that the final thing I'd want to comment on is that as we've done this work, it's one of the, I think, pleasures of working in healthcare, is when we do face crisis, there's a true spirit of teamwork. And I think across our organizations and in our community, there's been tremendous generosity and compassion to prepare for this crisis that's before us. And that teamwork has been inspiring, I think, both to us internally working in healthcare, and I know from the feedback we've had from the community, which we truly appreciate, that it's inspiring to others, that effort that we're putting into preparing. So thank you.
Winnie, just before we move on to Wes, I just wanted to confirm, because I thought I heard you say we have 19 COVID positive patients in the hospital, but I believe it's 7.
Oh, if I said that, I made a mistake. Thanks, Melissa, for the correction. We have 6. I apologize.
Thanks very much. So next, over to Dr. Wes Stephen, who is the Executive Vice President of Clinical Operations and Chief Operating Officer at Hamilton Health Sciences. I see you've already unmuted and are ready to go. Wes, over to you.
I think I learned from my previous speakers to unmute. So thank you, Aaron. First, I would just wish to state that we currently have 12 inpatients across Hamilton Health Sciences with COVID-19, and they are in cohorted or COVID wards. As previous speakers have discussed, the importance of infection control and trying to minimize the spread of this virus. And the province has assigned Hamilton Health Sciences a COVID-19 bed capacity target to achieve by the end of April. This includes 170 acute care beds and 60 critical care beds. I'm pleased to say that we've exceeded this target with our planning. The work mentioned so far by both organizations is remarkable in every sense. The complexity, the speed, and attention to detail required for creating this capacity cannot be understated. It is a true tribute to our teams who have worked extremely hard over the last several weeks. Over the last month, thanks to all this tremendous effort of our people and our community, we have been able to build our capacity further every day by winding down non-urgent and elective procedures in ambulatory clinics and decanting patients. We are aware that this does have impact on our community. However, with the pandemic, we have a big challenge ahead of us. At present, we have over 300 beds available for COVID patients. 100 are located at the Hamilton General, 70 at the Juravinski Hospital, 70 at the McMaster Children's Center, and 60 within our regional rehab program, which is located in 2 sites, one at the Hamilton General and one at the Juravinski Hospital. Our current planning trajectory is that all conventional space will be made available for the pandemic and will be used for this purpose. We are in the process of adding 70 more acute care beds at Hamilton Health Sciences by decanting ALC patients. We are also doubling our critical care or ICU capacity from 60 to 130 beds by doubling up the number of patients in the existing ICU units. We will be able to add 100 more critical care beds at Hamilton Health Sciences as needed, using alternate clinical spaces such as our heart investigation unit and other surgical areas, in addition to our traditional ICU units. To achieve this capacity, if it is needed at a peak demand, we will be looking at unconventional spaces beyond our facilities as well. That is why we are working collaboratively with St. Joseph's Hospital to secure an alternative hospital space in our community in a large hotel or convention facility. This is the final stage of capacity planning as outlined in a phased approach, as already mentioned by Melissa. We are looking to maximize the availability of essential infrastructure for patient care, including laundry, food service, and washrooms. We're also looking to minimize the transfer and transport of COVID patients. Ideally, using a single location for both hospitals, this can be accomplished. This would open up an additional 300 new beds for Hamilton Health Sciences and 150 for St. Joseph's. An announcement will be made very soon once we have a formal agreement in place. In summary, in total, this will provide our community a peak capacity of 900 beds from Hamilton Health Sciences, 370 acute care, 230 critical care, and 300 alternate or beds in the community. Back to you, Aaron.
Okay, thanks very much, Dr. Stephen, and thank you to all of our panelists for those opening remarks. We have the opportunity now for questions from those journalists that have joined us today. I'll ask my colleague Tom Perry to call on the first question. A reminder that you'll have one question and one follow-up so that we can make sure that we get to everybody in due time. So Tom, over to you.
Thanks, Aaron. The first question is from Dan Takema from CBC Hamilton.
Hey everyone, thanks for doing this today. We're talking a lot about this alternative location, whether it be a convention center or a hotel. Is there a particular location in mind, or has that conversations have been had with about setting up hospital there should capacity be needed?
So I'll take that question. Conversations have been held with various parties within Hamilton, and we will be prepared to make an announcement once the formal deal, which is quite close to being completed. Once it's completed, we'd be very pleased to tell you the exact location.
Okay, and just on that then, can you talk a little bit, or someone, can you speak to the difficulties or the challenges to making kind of an unconventional space work, whether it be a lounge or a hotel, in terms of medical hygiene and issues like that?
Winnie, were you going to jump in? You were muted there if you wanted to make some
Yes,
comments.
my comments about being a slow learner are true. So this is something that we do have some experience doing, because we've had surges in our systems already. I mean, we had the St. Peter's fire. This was a time when we had to rapidly respond and create accommodation for patients very quickly. So we're familiar with doing this, but it'll be a different challenge, and I think a greater challenge. The issues that will be the principles we'll want to maintain, Dan, are that the strict infection control to the greatest extent that environment will enable that, and that we have hand washing facilities and bathroom facilities that meets the needs of these patients. So we do understand what we need to do in that regard. It is the space we will go to when we've exhausted the more appropriate space. So it's contingency, not our first choice.
Thanks, Tom. Our next question.
The next question comes from Doyle MacIsaac from CHCH.
Go ahead, Dale.
Hi there. I was curious on the St. Joe side. I know on HHS the total number of beds would reach 900. So what is the total for St. Joe's? I'm not sure if I missed it earlier.
Melissa, do you want me to speak to that one? So we have the capacity to create 110 critical care beds and just over 100 ward beds should we need that volume. That's without going to our unconventional space.
And in addition to the 200 freed up capacity we already have, right, Win? Yeah.
And how many ventilators does the city have, or do both hospitals have?
I can start from St. Joe's, or Wes, do you want to?
Yeah, I think we'll get a bit of an echo, sorry. We actually, the plan that's been presented to you, we believe we have enough ventilators to actually provide that care. If and when we get to a point where we go beyond the modeling or the targets that we've discussed today, there is a provincial resource that we'll be looking at to draw upon and look for some help and support provincially. So as the plan has been stated today, it includes our ability to provide a ventilator in our critical care units.
Tom, our next question.
All right, thanks, Aaron. Nobody has their hand up, so I will assume most people want to have a question. So Joanna Furkatich from the SPEC.
Hey, Joanna, go ahead.
Hi, thanks so much for taking my question. In a webinar to staff, you talked about your worst case scenario at Hamilton Health Sciences. Can you both Hamilton Health Sciences and St. Joe's talk about the worst case scenario projections you have?
I don't know, maybe if I could get Dr. Stephen or Rob to start on that one. Oh, Winnie's unmuted as well. Go ahead. No. Wes, over to you.
Sorry, I was...
So sorry. So, okay. There is many modeling that is occurring. What the target giving to us from the provincial direction has already been sort of discussed. I think the philosophy that you're hearing from us is plan for the worst, hope for the best, and I think what you're hearing from us is really our worst case scenario plan, in that we're presenting that we have exceeded the capacity and that we're expecting to meet the needs of the community. However, it is a pandemic, and there is a very fluid file, and the modeling constantly changes. So I think we are, I believe, from presenting what we think is kind of on the worst case scenario. But I'll turn over to Winnie for her view.
I think that what Wes has said is perfectly true. We none of us, Elizabeth said at the beginning, none of us have a crystal ball. But Joanna, I think the numbers we gave you on critical care and the number of beds is thinking towards the worst case scenario, but knowing that we may need the capacity that we've spoken of in the community in terms of other space that should the demand exceed what we are planning at this stage.
Thanks so much. And my next question is around staffing. Do you have the staff to staff these beds that you're planning for?
I can start off on that one. I think we have got quite robust staffing plans in place in some regards. We have done medical schedules. Our medical leaders have been very involved in creating schedules to provide medical coverage across critical care, across medicine, anesthesia, those sorts of areas, which will be all very important. On the non-medical staffing, we are indeed undertaking significant planning in terms of staffing. We have redeployment officers at both of our hospitals to help where we don't have demand in certain areas to redeploy. But I think if we reach these peaks that we're speaking about, it's important to understand that our staffing models will be quite different than they are today. And we will have, if we reach those higher numbers of staff per physician, per nurse, per respiratory therapist than we would have in normal times. This is a pandemic, and those adjustments are critical for us to do as the demand increases.
Thanks very much. Just a reminder to those that have a question to please use the raise your hand function so we can identify who has questions. Tom, is there anyone in the queue right now?
There is. Thanks, Aaron. Let's go to Lisa Paluski from Global News.
I am actually going to cede my question to, I know a couple other of my colleagues are on the line, Ken Mann and Don Mitchell, so I just wanted to, if they have any questions, I'll give them priority. Thanks.
Let's do that right now. Don Mitchell.
Don, go ahead. Going once. Going twice.
Fine.
Hi, you there, Don?
Yeah, I'm there, but I don't have a question right now. Thank you.
All right.
Okay, great.
Let's go to Katrina Clark at the SPEC, who's been waiting patiently as well.
Hi, Katrina, go ahead.
Hi there, can you hear me? You can, okay. My question, it's regarding the plan to open up more beds. Does it tie in with the ministry asking long-term care homes to move convalescent patients out of the facilities in order to be able to move patients from the hospital into the long-term care homes?
Katrina, my understanding of what the ministry has done is in terms of long-term care, their convalescent care homes, their convalescent care beds are going to be converted to long-term care beds, is my understanding of what has changed in that regard.
Thank you. Does that though tie in with the hospital's ability to make more beds available by, say, moving patients that
Yes.
could be in long-term care beds? It moves.
Sure, it does. It's a significant help. I think it's important to keep in mind that long-term care is an area that's highly vulnerable to COVID, and we do have some long-term care facilities that are in outbreak in our community, and the transition of patients when a facility is in outbreak isn't the same as it is when they're not in a COVID outbreak. So that's just an important thing to keep in mind.
Thanks, Tom. Do we have a next question, please? Just a reminder to raise your hand.
Absolutely. We'll open it up to John Best from the Bay Observer.
Hi, John, go ahead.
I don't have a question. I'm just listening. Thank you very much.
Okay, great.
All right, let's go with Samantha Craggs from CBC Hamilton.
Hi, Samantha, go ahead. You might be on mute.
Samantha emailed earlier and her microphone's not functioning.
I see. Is there anyone else in the queue, Tom?
Just working through it right now. Let's go back to see if Lisa Paluski wants to ask her question after she deferred.
Hi, Lisa. Would you like to go for it or gift it off?
Actually, quite honestly, most of my questions were already asked by other reporters, so I'm good. Thank you.
Okay, no sweat. Thanks a lot. Tom, you're not having a lot of luck here.
What else is new? I think that's, unless anybody else wants to raise their hand right now to ask a question, I think that's it, other than Dr. Stephen. Oh, sorry, I got one more from Dan Takema from CBC Hamilton.
Hey, everyone. I figured just since we have you here, there's been a lot of concern around PPE and supply. So since we have all these high-ranking hospital officials, I wanted to check in and see where the hospitals are at on PPE and what concerns, if any, remain around the supply.
So it's Rob here. We continue to be very concerned about the supply chain for PPE, which is why we're doing all that we can to conserve the supplies that we have. We're very hopeful that the supply chain will start to ease up. But at the moment, our inventories are not where we'd like them to be. And we are continuing to work every possible avenue ourselves to try to secure more PPE. We're also working, of course, in partnership with both the provincial and federal governments who are also working very hard to shore up PPE supplies. But in terms of where we are today, we think we're being responsible with the policies that we are employing around PPE. We're getting advice from the foremost experts in the field around making sure that we're doing a good job of keeping our staff safe. But obviously, everything that we're doing is in light of the fact that supply is constrained. So we have a host of conservation measures in place that are helping to mitigate the burn rate of PPE.
Melissa, I see you've unmuted. Did you want to add?
I did, but honestly, I would just echo everything that Rob has just said. This obviously remains a significant concern at St. Joe's too. We have adequate supply right now, but we have lots of conservation efforts underway because of the critical shortages that exist across the entire world. Working with the region, federal, provincial governments on this issue is an absolute priority for all of us. To make sure that we can protect our patients, our staff, and our physicians as best as we can.
Thanks. Tom, over to you. Do you have another question queued up?
Joanna Furkatich from the SPEC has another one.
Hi, thanks so much. I'm looking to find out if you have been seeking volunteer staff or people to come back in the way that other places have, so like retired workers or foreign trained workers or students, things like that. Do you know how many of, are you using those yet, or how many do you have on a list, or are you looking at that at all?
So I think at Hamilton Health Sciences, our HR department has been very active, working with our CNE, looking at various avenues. We have reached out, I think, to approximately 700 recent retirees in the last 2 years, seeing if they would come back. We have several other avenues that we are pursuing, and I can't give you a number of how many successful re-entry people we have from retirement, but it's an active file because we recognize as we escalate the peak demand, we need to have staff to support the care of the patient.
Yeah, and we would just echo the same thing on the St. Joe's front. So we have, there was a call out to retired staff, and we've heard back from many of them. But we also are doing a joint call out to the community, both HHS and St. Joe's. In fact, I think it maybe went out this morning. So actively looking for anyone within the community that has the experience or has the, I guess, some knowledge, expertise would be interested, so that we can have some reserve capacity. Right now, I don't think we have really anyone that we need in the pool at the moment, but this really is for as part of our preparedness to make sure that we have all the resources that we need.
All right, so we do have a question from Sam Craggs. She from CBC Hamilton. She sent it in. It's does HHS or St. Joe's have any concerns about being able to accommodate patients from smaller areas, for example, Haldimand?
Maybe. Go ahead, Rob.
So I would say we don't have concerns about that. I do think that in the planning that we're doing, we are both planning as a city, but we're also planning as a region. And so we are just putting the finishing touches on a regional plan for the former HNHB Lynn, where we've looked at the plans, the capacity plans for every hospital within that catchment area. And so we're collaborating across those lines and making sure that every community within HNHB has a fair access to the resources, the health resources that will be needed to get through the pandemic. So for smaller hospitals that don't have critical care capacity, they are being partnered up with hospitals that do have critical care capacity. And the capacity targets that we talked about for the city have been, scaled up to the regional level so that we are trying to anticipate what might happen across that broader region, making sure that we're acting to the extent possible as a system across all of those hospitals, and no one's getting left out.
Okay, we have one more question, which may be coming from Dale Manukduk or maybe from Chantel Grillo at CHCH. Whoever's mic I just unmuted, please go ahead.
This question's for Rob or Melissa or both. Can you guys expand on what the conservation methods for the PPE is that you guys are employing?
Yeah, I can start, and maybe Melissa, you can follow up. Actually, I guess I would say the strategies we're pursuing are really grounded in the risk associated with any given individual's job within the hospital. So we've gone across literally, every unit in the hospital and done a risk analysis and implemented PPE measures which accord with the level of risk associated with the jobs that those people are doing. That's consistent with the provincial policy around PPE conservation. I think, at some point during this next, while as the virus continues to take hold within the community, we'll ultimately get to a point where everybody has to wear a mask, and that's appropriate given the risk levels. But until we get to that point, and that point is really determined acting on the advice of our subject matter experts in the field, we are allocating PPE in accordance with the risk levels associated with particular procedures and particular jobs. So it is a fairly intense exercise and does become quite technical, but I feel comfortable that we've acted responsibly based on our supplies and based on the scientific evidence around risk.
I would just echo what Rob just said in terms of the approach that's been taken at St. Joe's too. Actually, we've been trying our hardest to make sure that our frameworks are really aligned with each other's. and following provincial direction in terms of that risk framework around various departments. I think some of the other protection or conservation initiatives that are just important to highlight is, and some of this also has been direction that we've been receiving from the provincial government too, is to really make sure that we are, it's not restricting access, ensuring that individuals have access to the PPE that they need when and where they need it. So doing the full assessment of the inventory, locking down certain inventory that may be required, or significantly restricting the access to that inventory where necessary, doing the active tracking that is required from a conservation perspective too. Is there anything that Wes or Winnie might want to add when we're talking about PPE conservation?
I think you guys have covered the topic very well.
Yeah, the only thing I would add is our strategies in the beginning to reduce surgery, to reduce visiting, all of those things in addition, that they are to create the capacity, because if we had normal services running, our use for PPE would be much greater than at this point. So beyond creating bed capacity, those elements of the plan contribute to conservation.
Yeah, good point.
Thanks, everyone. Tom, do we have any more questions?
That looks like it's time. That looks like all the hands that were up. Thank you, everyone.
Well, thank you, everyone, for joining us today. Thanks to our panelists. Sorry, Rob, were you trying to ask a question?
No, I didn't have a question, but I just wanted to say one more thing, or a couple more things. I think it has to be said that all our efforts will be in vain if the community doesn't do their job. Our plans are very much contingent on people observing the rules around physical distancing that were outlined earlier by Dr. Richardson. And I know it's Easter weekend coming up, and it's a time when most of us get together with our families and give thanks. We are very hopeful that, as difficult as it will be, that people forego those traditions for the benefit of all of us and maintain their physical distancing. Finally, I just wanted to acknowledge on behalf of all of us, our teams and all of the partners across all of these communities that we're serving here in the city and across the region, who have come together and worked so hard and so collaboratively in the face of this very dynamic and challenging situation. I also want to acknowledge the extraordinary commitment and passion of all our frontline workers as we enter into the coming weeks.
Thanks very much. Great point to leave it at. So thank you, everyone, for making time for this today. As some of these developments proceed, we'll endeavor to do this again. Until then, please, one and all, stay safe.
Thanks.